Let's first look at one of the key news items as well, because we've seen India has been witnessing a marginal uptick in COVID-19 cases. Health authorities are turning to their focus as well to JN.1 variant. The new version of the coronavirus has been reported in parts of Asia, with rising hospitalizations in Singapore and deaths reported in Hong Kong as well. Now, the variant is under close scrutiny globally as well, even though India's current COVID situation remains largely under control. Currently, government data shows 257 active COVID cases across various states in the country, with most of them coming from Kerala, Tamil Nadu, as well as Maharashtra. Now, to discuss this a little further, we are now joined by Dr. Rama Subramaniam, who is the Senior Consultant in the Department of Infectious Diseases at Apollo Hospital, Chennai. Dr. Rama Subramaniam, thanks so much for joining in. A very good afternoon to you. It's Puneet this side. Firstly, I just wanted to start off, before we get to the preventions, what according to you is leading to this rise in COVID cases again across the Asian continent? Let's first start off with that, and we'll get into the preventions much a little bit after that.
Yeah, good afternoon. Glad to be here. Now, this is the normal process of an infection, the evolution of the virus and how it spreads. This is exactly how it happens. We have realized that COVID is probably here to stay. Just like the earlier versions of the coronavirus, the mutated SARS-CoV-2, which came in by late 2019, is now adapted to survive in the human population and cause periodic outbreaks, just like probably the influenza virus. So this is nothing new. The virus constantly keeps mutating. It changes itself so that you get a newer version with several different mutations. But fortunately, all the current mutations which we see are mild infections only in the majority of the population. So just like the flu, it causes a little bit of a fever, cough, cold, sore throat, lasts 4-5 days and settles. But in people who are very elderly, people who are obese, people with severe comorbidities, people who are immunosuppressed, in these patients, it can cause severe illness, sometimes even leading to death. So this is not something new. This is what is expected, and it is behaving that way.
So not something new, something that's expected, something that we've seen in the past as well. That's what Dr. Rama Subramaniam is mentioning. Dr. Rama Subramaniam, just to get into some of the key preventions, both for people, as you mentioned, who might have some pre-illness or pre-disease, what are some of the key aspects and precautions that they should be taking, as well as for people who are, moving around for jobs and traveling across in public transport, what would be some of the key precautions that you would suggest for them as well?
Okay. Now, it has been very clearly shown that vaccination probably is the only major factor which can prevent seriousness of infection once you get it. So ideally, you need to have a vaccination, at least people who are elderly above the age of 65, people who are immunosuppressed, they definitely need a booster which will cover the current circulating strains of the virus, which unfortunately is not available in India. So this small group of people who have a higher risk of complicated infections should be ideally covered with a booster shot of vaccines. But otherwise, in India, still the good old advice with regard to wearing of masks when you are in crowds, especially when you are in traveling, in functions, in gatherings, you definitely need to wear a mask. The same thing what we advise for influenza also holds true for this. Hand hygiene periodically, avoid taking your hands near your face. The same advice is what we can resort to. So just by doing this preventive measures, we can definitely help protect ourselves. But vaccination, I hope only if the seriousness of the infection increases, Indian companies will come out with vaccines. So we have to wait and see how this pans out.
Also, Dr. Rama Subramaniam, over the next, we have been seeing that the monsoon onset will come in, and that's generally, of course, the flu season as well. So this could lead to some more increase in number of COVID patients as well. My final question to you, it's a time of travel as well, and we've seen across Hong Kong, Singapore, and Asia, it's a key travel destination as well. So anything on that aspect that we need to take care of, because that's been one of the key aspects, and we've seen those states as well, which have a high, travel quotient. Maharashtra, Kerala, Tamil Nadu, there the infections have been rising as well. So in case you are traveling either for business or for personal, what are some of the key aspects to note in those countries as well where these infections have been rising, as well as which you might catch in a country that's not been seeing increased infections at this point of time?
First of all, if you have symptoms of cough, cold, fever, body pain, do not travel because you are likely to pass the infection unintentionally. You may not be aware, but you could be having COVID. So please do not travel. Stay at home if you are unwell. If you are traveling, we strongly urge all people to use masks when in public. Carry a small bottle of hand sanitizer, which you use periodically. And as far as possible, stay away from people who are coughing or who seem unwell. This would be the simple ways. Do not touch inanimate objects around you because inadvertently you take your hands near your face. Frequent hand hygiene, masking is still the good old way to keep yourself safe.
Got that, Dr. Ramasubramaniam. Thanks so much for joining in, giving us a whole host of views, of course, on the new COVID increase, as well as some of the key precautions needed to take. We look forward to our next conversation, but thanks so much for joining it today.
Thank you. Bye-bye.